So welcome everybody. Thank you for joining. On behalf of the University of California Center for Climate Health and Equity, the Eco Health Center, and the UC Climate Change and Mental Health Council, we welcome you today. Our six-part webinar series on urban wildfires and protecting health and well-being is co-hosted by UCLA Center for Healthy Climate Solutions, the Fielding School of Public Health at UCLA, the UCSF Alumni Association, and the communications team from both UCSF and the UC Office of the President. I want to reiterate my thanks to our amazing team of faculty and staff who put this webinar together in a very short time period, including my CCHE co-director, Sherry Weiser, Alyssa Eppel and Jyoti Mishra, who run the UC Climate Change and Mental Health Council, David Eisenman, Mike Jarrett, Jennifer Shear, Claire Brindis, Tarik Benmarhnia, Neetha Thakur, Robin Cooper, Philippe Golden, Sigal Maya, Anne-Marie Charlesworth, and Annie Rosenthal. The impacts of the LA wildfires on livelihood and health are continuing to be felt, with over 57,000 acres burned and 16,000 plus structures destroyed. Many have lost their lives and have been injured. For those who have lost their homes and continue to seek shelter and support, and for those returning to their homes and spaces, the health impacts are yet to be determined. And our hope is that this series will prepare California and the University of California communities to protect themselves. In today's session, we will hear from experts in California and throughout the US talk about the impacts of climate disasters such as wildfires on the brain and vital cognitive functions. And the team will discuss important climate resiliency efforts that protect brain health. Our webinars are recorded and links will be sent out to all who signed up, and we are working on translations into Spanish as well. You can find resources on our website, which we have included in the chat, and we hope our center will serve as a resource to really everybody who needs help at this time. As a heads up, our session next week is going to focus on policy issues and wildfires, and that will be the last of our 6 sessions. With that, I'm going to turn to our esteemed moderator, Dr. Tarik Benmarhnia. Dr. Benmarhnia is an associate professor of epidemiology in the University of California, San Diego, Scripps Institution for Oceanography, where he leads the Climate Change Epidemiology Lab. He is also the co-chair of research for the UC Center for Climate Health and Equity, and is an affiliated researcher with UCSF, the Universidad de Chile in Santiago, and INSERM EHESP in France. As an environmental and social epidemiologist, his work focuses on applying or developing causal inference methods to understand how environmental and social determinants affect population health and equity in the context of climate change, but also what strategies are effective at minimizing such impacts. Thank you, Tarik, and I'll turn it over to you.
Thank you so much, Arianne, and thank you everybody for joining us today. And so we'll be happy today to moderate the session, and I will introduce each of the speakers, and at the end I will moderate the questions. So just a reminder that we will have the Q&A after all of the talks. So if you have any question, you can use the chat to put your question together, and then we'll go back to your question at the end. So for the first speaker, I'm extremely happy to introduce Joan Casey, who is a very good colleague and friend. So Joan Casey is an associate professor in the Department of Environmental and Occupational Health Sciences at the University of Washington, UW. So Joan is an environmental epidemiologist who focuses on environmental health, environmental justice, and sustainability, and her research focusing on a relationship between emerging environmental exposure and population health across the life course, including on wildfire and brain function and brain health, and focusing on multiple exposure, including wildfire, power outages, ambient temperature, the built environment, and fossil fuel infrastructure. She is also an editorial board review member for EHP, and so we share that as well. So I'm very happy to have Joan speaking for us today. So yeah, floor is yours, Joan. Thank you.
Thank you so much for that super nice introduction, Tarik. Okay, I will get right into it. We have a lot to talk about. So I am going to focus on wildfire impacts on the brain. We know wildfire smoke is a mixture of particles and gases, the most important particle being PM 2.5, or particles less than 2.5 micrometers in diameter. And I'm going to really focus in on the health implications of that wildfire, PM 2.5. This is a really important exposure. After the Clean Air Act passed in 1970, the United States has enjoyed improvements in air quality in PM 2.5 also. But since around 2015, we have seen a reversal in the improvements in PM 2.5 concentration in the Western US. You see the Northwest here, the West and the Southwest, and this sharp upturn in terms of annual average PM 2.5 concentrations. And this is driven by the increase in wildfire smoke in these states. So I'm going to focus on dementia, but a lot of what I'm going to talk about is applicable to other impacts on the brain. So when these fine particles are inhaled, they can penetrate deep into the lungs, they can move into the bloodstream, they can cause inflammation, oxidative stress, DNA damage, things you don't want happening in your body. And these processes also precipitate cardiovascular disease, which we know increases the risk of folks developing dementia. In addition, compared to other sources of PM 2.5, wildfire particles tend to cause more inflammation. They also have a higher fraction of ultrafine particles, so particles that are 25 times smaller than PM 2.5, that can actually move directly from our noses into the brain, directly damaging brain cells. This could potentially increase risk of dementia. The other thing we know is that in mice, exposure to wood smoke is able to cause measurable neuroinflammation. So there are a host of pathways connecting wildfire PM 2.5 to kind of downstream neurological endpoints. And one thing I want to touch on in light of the recent tragic wildfires in Los Angeles are that the species of wildfire PM 2.5 might matter. This is work from a doctoral student at Stanford, Emma Krasovic, that just came out very recently in ES&T. But what she is showing is an increase in lead particles in the Western US. You can see the turquoise color here indicating that. And also, when structures are burned compared to wildfires that burn in forested areas, when structures are burned, there appears to be an enrichment of heavy metals in those particles as well. And we have a long history of environmental epidemiology noting that heavy metals are risk factors for things like cognitive decline and dementia. So this is important consideration. So our team has been really interested in understanding, because we're seeing increases in wildfire smoke in the Western US and exposures nationwide, unfortunately, whether long-term exposure to wildfire smoke is related to the development of dementia. And so to do some of this work, we've partnered with Kaiser Permanente in Southern California. We've used their electronic health record data from 2008 to 2019 to identify people that have a diagnosis of dementia during that period. And we identified those folks using diagnostic codes for dementia. One great thing about Kaiser's electronic health record data is they keep a record of historical addresses. And so we're able to track people who move across the study region. And so we ended up with a cohort of about 1.2 million people aged 60 and older over this time period. To their residential addresses, we linked their 3-year average exposure to wildfire and non-wildfire PM 2.5. And that's what you're looking at on these two panels here, with wildfire on the left and non-wildfire on the right, from sources like traffic, industrial pollution. You can see they have pretty different spatial distributions. And then we looked at whether higher levels of exposure to these two subtypes of PM 2.5 were related to incident dementia. And so what we saw was indeed both types of PM 2.5 were related to incident dementia. For a 1 microgram per meter cubed increase in wildfire smoke, we saw an 18% increase in the odds of developing dementia. And we saw disparities by participant race, ethnicity, and the level of poverty in their communities, where Asian, Black, and members living in higher poverty communities seem to have a higher risk associated with the same level of exposure to wildfire smoke. So this looks like we should start to be concerned about these long-term exposures, repeated exposures to wildfires for brain health. So for us, what are some quick next steps? We'd like to look at dementia subtypes. We know the etiology of things like frontotemporal dementia versus Alzheimer's are quite different, and understanding which are more closely linked to these wildfire exposures can help us understand other underlying mechanisms. Also moving on to look at other neurological conditions, things like Parkinson's. We've also done a little bit of work on headache and how that might relate to these exposures. And then finally, in this study, we looked at a 3-year period of average exposure, but we think the pathology and long-term development of dementia is happening over, up to 10 years or longer. And so we'd like to be able to look back farther. And so that's a next step to figure out kind of what are the relevant windows and over what time period should we be concerned about these exposures for health. So I'll wrap up there. Thanks to many collaborators and to the National Institute on Aging for funding this research. Thank you.
Thank you. Thank you so much, Joan, for this excellent presentation. So now we're going to go to the next speaker. So I'm very happy to introduce Burcin Ikiz, who is a neuroscientist with over 20 years of research and consulting experience in brain disorders and mental health. And Burcin's work explores how climate change and environmental factors impact brain health and ways to transform these insights into tangible global health advancements. She is also the founder and director of EcoNeuro, a research initiative dedicated to exploring the intersection of neuroscience and the environment, which is quite, well, a very good fit for today. So thank you so much, Burcin, for joining us, and the floor is yours.
Thank you so much for your kind introduction, Tarik, and thank you for including me in these webinar series. They've been such an informative resource for me and my colleagues. Yes, and today I'll be talking about these disasters and climate disasters and change in general's toll on children's brain health. When we think about growing evidence show, such as the ones we just heard from Dr. Casey, on climate change's impact on brain health, it's quite multifaceted. It involves multiple factors related to climate change, anywhere from being exposed to excessive heat to extreme weather events and disasters such as hurricanes and wildfires, air pollution, vector-borne diseases, and so on. And we see that the growing evidence really shows that the impacts are on neurological health, on mental health, on cognition, and behavior in general. And children are the most vulnerable to these impacts due to their growing bodies, developing brains. They have immature immune systems, which makes inflammation much more sensitive, make them more sensitive to inflammation, and they have these dependence, emotional and physical dependence to the caregivers, which makes them a lot more susceptible to the negative health impacts of climate change. And as Dr. Casey had mentioned, when we think about the wildfires, one of the things to focus on is the pollutants that get into air, anywhere from the PM2.5 levels, as she has mentioned, that includes in urban wildfires, such as the ones we had experienced in LA, lead and other heavy metals. Any exposure to lead and these heavy metals can have huge impacts on the neurodevelopment of children. And these can be through these pollutants can enter through the directly penetrate to the brain through the nasal cavity, as well as causing inflammation systemically in the lungs or other parts of the body that can transport to the brain, where they go through the brain goes through oxidative stress, inflammation, as well as neurodegeneration. When we think about children's developing brains, first of all, because they breathe much faster, they do get these pollutants at much higher frequencies and at higher volumes in comparison to their brain volume. And these effects can have really lifelong impacts on their brain health and even intergenerational impacts. My colleagues, I lead a neuroclimate working group, and I have the privilege of working with these colleagues, Professor Pereira from Columbia University and Dr. Newberry from University of Bristol. They had shown in their studies, cohort studies over 20 years, 30 years of mothers who had been exposed to air pollution during their pregnancies and what happened to their children afterwards, years and years afterwards. And what they had found was that the babies that were exposed to air pollution in the womb during the gestation period were born at much lower birth weights and at more prematurely, which impacted their development of their brains and their gestational development. And then during the infancy, these children had more neurodevelopmental delays, decreased motor and cognitive functions. In early childhood, these children were more likely at risk of being diagnosed with neurodevelopmental conditions such as ADHD and autism. And in the young adulthood, they had more incidences of developing depression, anxiety, as well as psychosis and more serious mental illness. So this was just an example to show how long and intergenerational these impacts can be. When we think about wildfires, it's not just the physical impacts, but also psychological impacts on children as well. These disasters, especially when it includes displacement from homes, loss of communities, that can have significant psychological distress especially in all communities, but especially children, because of their physical and emotional dependence on their caregivers, where they cannot be able to regulate their emotions well or have a good sense of what's safe and what's not. And these can have really long-lasting impacts where it causes heightened incidences of post-traumatic stress disorder, depression, and anxiety in young people and children. My colleague, Dr. Nomura from CUNY, had shown that this kind of climate trauma can have mental health impacts in children that transcends generations. She had looked at moms who were pregnant during the major Hurricane Superstorm Sandy that had happened about more than a decade ago in New York, New Jersey area. And what she had found was these mothers that went through the acute stress of being displaced and going through this hurricane, their children afterwards had much higher risks of developing, again, anxiety, depression, and being diagnosed with neurodevelopmental conditions such as ADHD. And when we think about other factors that are related to climate change, this also includes heat. Children have much more difficulty in regulating their temperatures. And whenever the body gets too hot, the brain sees it as a stress response and goes through oxidative stress, mitochondrial dysfunction, and this really affects their connectivity and in communication between the neurons. And this can cause effects in children through their learning problems, difficult cognitive problems, difficulty in memorizing and attention and focus. If they have underlying neurological conditions such as epilepsy or psychiatric conditions, such as bipolar disorder or schizophrenia, they have much worsening of symptoms and harder time to be able to stabilize their disease due to the changes in the medication interaction due to heat. They also get a lot more heightened stress levels, and especially because of lack of good sleep, and can have increased aggression that we saw through the works of my colleague, Dr. Madenbauer. Well, when we think about all of these work and all these scientific facts, it gets really scary. And I can tell you that from a professional point of view, but also from a personal point of view, we had the LA fires that also affected us within the 5-mile radius. And I have young children who go to school and are playing outside on Earth, very close to in the vicinity of these fire areas. And this is a constant thought in my mind and of my other community parents. But one of the things, and also we know that a lot of young people feel very anxious about climate change and what's happening in the environment. And it may feel very normal to feel hopeless and that we have no empowerment to be able to make a change. But what we see from the scientific studies, and I can say from the personal point of view of seeing what's happening in our communities, is the importance of leaning in the communities, in our social connections, and the power of collective actions. My colleagues' work, Josh Carlson's work, had shown that for climate anxiety, the best antidote is really around this collective action, being part of a mission to do something good together, to not only look for helpers, but to become a helper too. And when we think about children, empowering them to be a community helper, become part of a community, and that social connections can have a huge implications and help in their neurodevelopment, socio-emotional growth, and also has the co-benefit of really power of helping our planetary health as well. There are many ways to do it, but I put one of them here. Our working group is working on a policy brief, thinking about how to take action in terms of public policy, but there's definitely many, many ways to do it. And we all have a role to play in this collective action. Thank you very much for listening, and I look forward to the other talks.
Thank you so much, Rashid. Thank you so much. So now we're going to go to the next speaker, my colleague Jyoti Mishra, who is an associate professor in the Department of Psychiatry here at UC San Diego. So Jyoti is the founder and director of the NEETS lab and also the co-director of the UC Climate Resilience Initiative, as Arianne mentioned at the beginning of this session. So Jyoti has research expertise in the study of climate trauma and resilience, as well as scalable digital mental health intervention and precision psychiatry. Jyoti research has been widely featured in multiple media, including CNN, Washington Post, the World Economic Forum, among others, and also have been cited recently by the National Climate Assessment as the first empirical evidence related to climate disaster impacts on mental health and well-being in the US, which is what Jyoti is going to talk about. So thank you, Jyoti, for joining us today, and the floor is yours.
Thank you, Tarik, for that very relevant introduction and really wonderful talks from Joan and Burcin, and great to have these colleagues. Today, I'm going to talk to you about climate trauma and resilience and the work that I have been doing in this field within our communities. I would like to acknowledge that this work is inspired by both my past and future generations. Pictured here is renowned climate scientist, Dr. Ramanathan, who's part of my family, and he has been part of climate science discovery and action efforts since the 1970s. And here also pictured my son, Arianne, who is an avid climate activist, educationist, and has a climate action book as well. So Arianne actually one day when he was in first grade brought a flyer to me about the deadliest campfire that happened in California in 2018 when they were fundraising for the wildfire survivors at the time. And when I contacted people in this region in Butte County, I was really struck by the stories of mental health distress that I heard. And the campfire still remains the deadliest fire in California. And thank God we have not had a worse fire still, although there have been other fires in terms of urban damages, obviously the LA fires in our recent past. In the context of the campfire, which was described at the time as one of the worst disasters that was seen, really with no words to describe it per the Californian governor, we were looking at mental health impacts. As per research, it takes a little bit to get research started, especially when you're working with communities. There's a lot of trust building and working with vulnerable populations. So the research that we did here was not in the acute aftermath of the wildfires, where mental health distress is somewhat natural, but in the chronic aftermath, which was 6 months to a year after the fire disaster. This is after the time when smoke has left the air, there's no more toxic chemicals in the environment. But what we find is that the mental health distress, the psychological distress that could have been initially triggered by the particulate matters and other daily life related troubles would have caused, percolated these issues over time. But what we found was that the mental health distress was widespread, even 6 months to a year after the fires. And the graphs here, what they were showing were that post-traumatic stress disorder symptoms, depression symptoms, and anxiety symptoms were significantly higher, almost 3 times greater in the directly exposed population versus a neighboring control population from another county that was not exposed to these fires. In the middle, what we see here are indirectly exposed individuals who witnessed the fires in their communities, but were not directly impacted. That they did not have loss of home or loss of any kind of injury to the family or loss of lives in any case. That is, the indirectly exposed folks simply witnessed the fires in their community. But still, you see this significant and graded effect where symptoms in the community overall were much greater than symptoms than in a non-exposed community. If we actually look at prevalence rates from this data, almost 30 to 40% of community members had symptoms that crossed a clinical threshold. Overall, these complex mental health symptoms came to be known as climate trauma in the literature, and that's how we start to define the complex mental health sequelae. And then we went on to show that it is not just the mental health symptoms, but underlying cognition and brain function is also affected in wildfire survivors. This study that was published in 2023 from the Campfire cohort showed that the ability to suppress distractions in our environment is significantly impacted in those that are exposed to the fires, both individuals that are directly impacted and indirectly impacted. So when this ability is struck, there is reduced ability to process distractions, which means that one cannot pay attention to the task at hand. And so everything around us, it feels like it is coming at us, and we are constantly hyper-aroused, hyper-vigilant, paying attention to everything, and not being able to focus. This, you will, if you have a family or friend from the LA wildfires, they will relate the same experience to you as well. When we looked at the underlying brain basis of this distractibility, we found that individuals who were exposed to the fires had much greater brain functional responses. So what you're looking at here are brainwave recordings made with EEGs that we were electroencephalography that we did with our community partners. And you can very clearly see the very intense colors in the directly exposed group versus the non-exposed control group. When we quantify that, then this frontal activity, especially that identifies the hyperarousal in this population, was extremely high in the individuals who said that they had been exposed to the recent trauma versus no trauma in this case. So our brains are also under this state of great duress, of hypervigilance, of scanning the environment, even 6 months to a year after the fires, as if we're constantly scanning for threats. And this hyperarousal came to be known as the fire brain. We've gone on to show that this can also impact decision-making abilities, especially when we're trying to make decisions that are good for the long term versus impulsive decisions. That decision-making ability is lost in the group that is directly exposed to the fires. So to summarize this section, what I wanted to tell you is that climate trauma affects mental health symptoms, cognition, and brain function. Per the second point, climate trauma as a term, when it was coined, beautifully acknowledges the circular relationship that we have between humans and the planet. What affects the planet affects us, and we are the problem in terms of the anthropogenic global warming that we're seeing, and we also can be the source of solutions, which will be the brief second part of my talk. Climate trauma also represents a form of trauma that supersedes or intersects with all other traumas, adding another layer of disadvantage for the communities that face the worst of climate change. These are our most vulnerable communities. These are the communities that have high poverty, low healthcare access, and they already deal with high levels of non-climate trauma. And these communities will suffer the most. So even for the LA fires, think about long-term rehabilitation in communities such as Altadena versus the Palisades. So moving away from that gloom and doom perspective, how do we build resilience and address climate trauma? In our studies with community members, when we looked at first individual or personal factors that promote well-being in the context of climate trauma, the factors in green stood out. These factors included a sense of personal resilience, that is, believing that I can bounce back from stressors, having good physical fitness. Individuals who exercised more had better mental health outcomes after the climate disaster. Individuals who practiced present moment mindfulness and did not let the traumas of the past seep into the present moment and really kept at appreciating the presentness, the nowness, and what we have in the present moment, those individuals also fared better. So overall, in terms of personal factors, a belief in oneself that we can come out and bounce back from stressors, being mindful, and moving and exercising to the best of our abilities can protect our mental health and well-being. In these studies, we also showed that individuals who had stronger family ties and a sense of community with others were also resilient in the context of climate trauma. And finally, we're working with community programs such as the Chico State and Maui ecotherapy programs. We had the good fortune of hearing from Blake Ellis from the Chico State program last week in terms of disaster recovery in this community, where we are promoting mindfulness, social cohesion, as well as nature connection to promote climate resilience. And together, these studies are having really important outcomes that we will soon be publishing. I would like to now give a shout out to our Climate Resilience Initiative. We are trying to focus on mindful social cohesion, just the way Burcin talked about how much social cohesion is important for our communities to build such resilience. And knowing the importance of that, we're offering a UC-wide stress break for young adults that's starting next week for 2 weeks, every evening for 30 minutes. Individuals can show up at any time and on any of the days, any of the 10 days. It's not necessary to attend all 10 sessions. And if you're interested, the registration link is in our climateresilience.online website. And we also, as part of our initiative, lead climate resilience education that my colleague, Philippe Golding, will talk to you more about. This education brings in resilience resources that build inner skills such as mindfulness and compassion, as well as outer skills where our students have to be part of climate action efforts within their communities. So with that, I will end my talk and really focus on the point that climate resilience and building such resilience is really a necessity for having our generations to flourish together. And thank you.
Thank you. Thank you so much, Jyoti, for your talk, for highlighting some of your work and also this psychological short and long-term effect. That was very interesting. And now for our last speaker, I'm very happy to introduce Philippe Goldin, who is a professor at the Betty Arwin Moore School of Nursing at UC Davis, where he teaches, conducts research, and mentors students in a topic of health promotion, clinical psychology, and cognitive affective neuroscience. As a clinical neuroscientist, Philippe investigates how different types of interventions, including cognitive behavioral therapy, mindfulness-based stress reduction, compassion cultivation training, and aerobic exercise, impact neural and behavioral indicators of emotional reactivity, emotional regulation, attention regulation, and conceptual self-views. I have no idea what these words mean, but I'm sure Philippe is going to clarify that. So
thank you for all of that. Thank you for all the other speakers. So, being the last speaker. I'm very grateful to everyone for putting this together. So let's go forward. So in the context of wildfires, and in fact, any disaster and all disasters that we have faced and we will face, stating the obvious, there is climate distress, climate anxiety, worry, fear, and dread, both proactively and also retrospectively, and also in the moment. And one of the questions is, what kind of emotion regulation techniques or strategies do we have innately in our brain systems, and that can be trained, right, through different programs to be able to address and work with that climate anxiety or distress, and to help us engage in the world in a way that really promotes climate activism, working together. So we're going to do a little nitty-gritty. So in the context of chronic stress, and as Dr. Mishra mentioned, it's not just acute stress, but the prolonged stress. Chronic stress hijacks our attention, our emotions, and very importantly, decision-making. There's some very beautiful recent research showing that this hijacking of our ability to make very clear decisions, informed decisions, it impacts in two different pathways in the amygdala. So what you see here in yellow, circled in yellow, is this small amygdala, and its connection to, in red, the striatum. And recent optogenetic research in mice has shown that there are two specific pathways that are impacted with chronic stress and that impact our decision making. The first one is that the chronic stress decreases our ability to engage in deliberate, goal-directed, well thought out decision making. So that's one of the impacts. It literally decreases that. On the flip side, a different specific pathway from the amygdala to striatum, showing that there's an increase in this autopilot brain mode that favors rigid, habitual behaviors, and that these can be delineated. What's amazing in the human animals that we are is that shown here in blue with this line is the frontoparietal executive functioning network that supports attention regulation, emotion regulation, perspective taking. And this is something that can be trained deliberately to be able to modulate the adverse effects of chronic stress. So one key takeaway here is that we can begin to delineate in very fine detail the different systems in the brain that are being impacted, but because of human capacity, we can train. And this goes back to our climate resilience course, compassion, empathy, that we'll touch in a moment. In terms of emotion regulation, in the context of threat, real or even just imagined or anticipatory, in milliseconds, the human animal has brain networks that respond to that, inducing fear, arousal, anxiety, worry, dread, in milliseconds, even before conscious awareness. This sends a bottom-up signal to other parts of the brain where there are functional brain networks dedicated to perspective taking, attention regulation, cognitive processing, that exert a top-down influence on that initial emotional reactivity to either increase it or decrease it. All of this is trainable. That's the wonderful thing. In us, humans, we also have other brain functions that are instantiated that relate to language, or specifically self-talk, how we talk to ourselves, how we speak to ourselves. And that's intimately related to the self-views, both positive and negative views of self that we carry that influence the type of emotions we experience, how intense they are, how prolonged, and also our cognitive and attention regulation abilities. So this whole system, when it's working well, is the actual neural basis of psychological flexibility. When it's not working well, overwhelmed by emotions, deficient top-down attention, cognitive regulation, we lose belief in our ability to cope. So there are many different kinds of emotion regulation and coping strategies. Just to put out a few, there are behavioral interventions that really have to do with interpersonal emotion regulation, embodied practices. There are mental practices that we know, like cognitive reappraisal, attention regulation, mindful acceptance, also maladaptive forms like avoidance, suppression, repression, but also nature connectedness. and empathic resonance. And importantly, also metacognitive skills like self-efficacy, or the belief in my ability to implement an emotion regulation strategy skillfully when I need to. All of these domains can be trained. Hence, with Dr. Alyssa Epple, Dr. Jyoti Mishra, and others, we created this climate resilience course, and it's being rolled out in last year, 8 University of California campuses, right now all 10 university campuses. Very positive empirical benefits in reducing symptoms of depression, anxiety, stress in the students, enhancing self-confidence, but importantly, also enhancing self-confidence in sitting with students' emotions in the faculty. That's actually a very important one. At the core, we create a space for students to feel together, collectively, without judgment. So this requires all of these different skills: compassion, empathy, listening, communication, not only in the students who meet together in small groups and in large groups, but also in the faculty and the meditation teachers who create the psychologically safe space for the students to dive into their emotions individually and collectively. In ending, I just want to say that interpersonal emotion regulation, the ability to sit with another person, the ability to know that what others are feeling and to respond to those with care, is one of the essential practices of being human. Our beautiful human brains are incredibly plastic, modifiable, trainable. So everything that I just mentioned, from the amygdala to the striatum to the prefrontal cortex, all these brain networks are changed and modified. We are the architects of our functional brain networks, which is really promising. And this is required. These are the mediators and the drivers, I would say, of our global well-being, our eco-well-being, that then feeds back on the interpersonal and on our brains. So thank you very much for your attention, and we all look forward to your questions.
Thank you so much, Philippe, for your talk. So now we're going to start the Q&A, and I see your questions on the Q&A. So I will start, if that's okay, with maybe a question for you, John. I will try to go chronologically. So maybe, John, can you clarify? There was some questions about just like distinguishing the kind of the direct impact, as you described, through the smoke and a specific PM composition, from like all of the potential indirect impacts, you know, due to like power outages, evacuation, and also the exacerbation of existing issues, especially in the context of the recent LA fires. If you can talk a little bit about this.
Sure. Yeah, it's a super important point. And I'd even take one step farther back and talk about direct impact. So we often hear about from wildfires, for example, in the LA fires, there's a number being thrown around, like 25 people or 29 people were killed directly from the LA fires. Then there's, of course, many more people than that truly impacted directly from the smoke exposure, from getting in their cars and driving and getting in a motor vehicle crash. So there's as you kind of go out through these layers, more and more people kind of are counted under this umbrella of affected by these hazards. And I think we're getting better at understanding that. So there's direct impacts from wildfire smoke in the present moment, which leads to things like exacerbations and people showing up in the emergency department for asthma, for example, which we have seen across a number of fires. Then there are, exactly like you're saying, these more indirect, but probably more widely spread impacts that are occurring through wildfires triggering power outages, people losing access to medical devices, people having interrupted care, or, for example, kids in LA not having school for a period of time. And all of these things, while the impact may be relatively small on the individual level, can add up across the population. And so it's exactly right. And it's even in the case of dementia, like I was talking about, it could be that wildfire PM is directly causing dementia to initiate. It also could be that it's exacerbating underlying health conditions that then bring people to the threshold of being diagnosed with dementia. And so it's hard to study this, and it's complicated because there are so many impacts, and we're not even expanding to talk about co-occurring heat, other co-occurring factors that folks are experiencing in relation to some of these events.
Thank you so much, John, for this very clear response. So then there were a few questions, but maybe I would like to pin this question from an anonymous attendee, but it will be for Burcin. If you can maybe clarify, I lost the question now, sorry. Yeah, if there is some heterogeneity in terms of the cognitive impacts seen in people with ADHD or similar neurodevelopmental differences, and if you can just like talk a little bit about these specific heterogeneous impacts.
Yes. In fact, it is really a growing field in the neuroclimate space is the role of neurodivergence and how and environmental stressors. Since when we talk about wildfire smoke, these pollutants can cause increased inflammation, as well as the emotional toll brings extra stress. And these, when we look at the molecular levels, we see it as oxidative stress, mitochondrial dysfunction, increased secretion of glial biomarkers, that stress markers, and these all can have a variety of changes in behavior, changes in cognition. And when we look at people with ADHD and so on, because the neural architecture works differently, then there could be more issues with focus and memory gets more impacted, as well as ability to regulate emotions and behavior changes as well. But this is still a very growing field, so there has to be more studies done on this specifically. Great question.
Thank you so much. And so now just Zara, like just for Jyoti and Philip, just so you know, there are a few questions about the availability of the results of your evaluation of the climate resilience class. And also a few questions maybe for Jyoti and Philip about to which extent maybe the climate resilience course that you presented that is presently being provided to UC students, to which extent this type of training can be, and that you show to be effective for the students that took this course, to which extent this training can be maybe generalized to other public, to other audiences besides college students, and how you see this kind of extension of this type of activity that will help people be more and more resilient towards this kind of cascading effects.
Do you want to jump in there, Jyoti? Go for it.
I can, sure. I can start and you can end. Great. Yeah, I think this is, in the new world that we live in, this kind of training and resiliency skills are important throughout the lifespan. We've started with young adults, partly because we're at the university and can leverage the university resources, and young adults also happens to be the age group that is most experiencing the effects of climate anxiety. At the same time, I think other cohorts can be trained. It's just we need more man and woman power to help us, disseminate these really awesome skill sets. And mindfulness, compassion, social cohesion are much needed in our society. So, yeah.
Yeah, I'll jump in and just briefly, because I'm analyzing the 4-month follow-up from course completion. And one of the key things that's promising is that the sustained beneficial effects on reduction of symptoms of depression, anxiety, stress, increases in self-efficacy, both individually and collectively, and also a decrease in climate distress. That is essential because as the stress level, which of course is there's this individual threshold for everyone, as that decreases just enough through using mindfulness, radical acceptance, cognitive reappraisal, even distraction, and other kinds of emotion regulation strategies. As the anxiety goes down just enough, it frees up the resources, as I showed, of frontoparietal executive control, attention regulation, inhibitory control to do its job. So that's one of the things that happens with anxiety, is that it actually disinhibits a flooding of activity that shuts off innate abilities that we already have. So whether it's ADHD, the full spectrum to a healthy brain or diverse brain, is the ability to know how to modulate the amygdala and different nuclei of the amygdala and the frontal parietal cortex to make sure that there's enough access to the resources that are in the brain. And again, this entire system is trainable through things that we're doing with the climate resilience training. And hopefully we will send it out further to high school students. That's one thing I'm passionate about, because they're ready. And the high school teachers and the high school students are hungry and ready to absorb this. And they can definitely integrate this into their minds and lives, relationships. Yes.
Excellent. Thank you so much, Philippe. Thank you so much, Jyoti. And also I wanted to know, there are like a few questions, if you can, just about providing a little bit, some details about the result you showed or some links. So if you can address them on a Q&A, Philippe and Jyoti, that will probably help a few of the attendees. In the meantime, I just wanted to ask a question that I think will be answered by all of you, all of the panelists in a different ways, about just like, how do you think, or what should be the priority for training for health professionals? So we talked about this opportunity for like psychologists, neurologists to know about this information, but what do you think could be the priority in terms of training for health professionals to better deal with this kind of expected to increase incident cases in terms of brain, cognition, and psychological effects? So I don't know who can start chronologically, if that's okay, or maybe Burcin. Sorry, go ahead first, and then I'll go with Joan.
I didn't realize you were going to say chronologically, Joan. I didn't want to take your turn.
That's okay.
This is a great question, and there is a lot of different resources out there that are growing in terms of thinking, training programs, going into medical schools and doing these trainings, providing guidance to practicing neurologists and psychiatrists on when a climate emergency happens, what to do, some kind of practical guidebooks. These would be really important resources. There's Columbia University has a global consortium on climate and health education program. They provide a lot of training resources, webinars, guidelines. I'm part of that group too, and we recently prepared for the Pan American Health Organization these pamphlets, these guidebooks, exactly for what you said, to be on the hands of every practicing neurologist and psychiatrist in Latin America. And these are some of the training opportunities, and be able to get it into schools as early as possible to make incoming generation of medical professionals thinking about the climate change would be a really important part of this work, I think.
Thank you, Burcin. Joan, would you like to go about training, maybe for the big health audience or whoever you want?
Sure, absolutely. I think this is critical, and I would kind of turn it on its head. I think some of the evidence shows the general population really wants to hear about this from their medical providers, and that's who they trust to convey information about how to handle climate change, whether it's for respiratory health, brain health, whatever the case may be. And so giving clinicians these resources is critical, because I work with someone in Washington State who surveyed pediatric pulmonologists, and a limited portion of them felt equipped to talk to their patient population about wildfire related exacerbations of their respiratory conditions. And these are the respiratory providers for kids in Washington State. And so we have this gap between what people need to hear from their providers and what providers have been trained to provide. But I think the hunger is there. And like Burcin said, we are seeing medical schools build this out. I know Kaiser's medical school also is building out a climate program, which I think will be really quite effective. And so it's getting the resources that folks are developing into the hands of these people.
Excellent. Thank you, Joan. And maybe Jyoti and Philippe, your perspective on training for health professional, being both of you, like either of you in a school of psychiatry or nursing, what do you think would be the priority for training your colleagues?
Yes, absolutely. More awareness needs to be gotten out. We do definitely see greater awareness, especially in urban areas, but rural areas, suburban areas are not yet fully trained. And, you know, even in the context of the community studies, sometimes I would get correspondence from people who have suffered from these fires saying that we have to take your study to our doctor so that they can be aware that such stressful impacts can emerge because they don't know about it otherwise. And really acknowledging what that source of the trauma can be a first step towards proper healing for the individual in the healthcare setting. So it's definitely necessary, and you know, the CCHE provides a great resource for education of healthcare providers. It allowed us to, this center allowed us to do the psychological first aid trainings in the first couple of weeks after the LA wildfires, and you know, 250 or more physicians attended those trainings live, and many more, 4 times more, registered for it. So there's definitely a great need to understand the impacts and also what to do about it.
Yeah, the only thing I would add was 2 points. One is to not pathologize feeling climate anxiety. It's actually a rational response to real facts. That's one thing. In any of the communication between healthcare providers, or actually anyone. The other point is, I think it'd be wonderful to scaffold family discussions, specifically to provide concrete tips for families on how to have discussions at home. Of course, school would be great, but also at home, to how to talk about this preemptively, post hoc, to support opening within families, to expand the conversation about what to do, what it means to feel, what you might be, you might model how to feel for when you're interacting with other friends. Yeah.
Excellent. Thank you so much, Philippe, and thank you everybody for today. And now I think we're ready to wrap up the session, and I will let Arianne wrap up this session. Thank you so much to all of the speakers and to all of the attendees.
Boy, thank you all very much. This was a wonderful session, and it was great to be in community with you and learn from your expertise. As I close out, I just want to remind you to sign up for the next webinar, which will be held at the same time next week, and the registration link will be at the link on the link that was sent out. This last webinar is going to be the last of our 6-part series, and it'll be moderated by Dr. Sherry Weiser from UCSF. It includes a slate of speakers and experts who will provide guidance on the important role of policy in the interface between wildfires, climate change mitigation, and health. And so with that, thank you very much. Thank you to all the speakers, and we will wrap up.